Hello, my name is Anna Smith, a final year dental student at the University of Birmingham. For my dental elective project, I conducted a qualitative situational analysis on pediatric oral health in Blantyre, Malawi. This project was driven by community engagement and involvement research, with stakeholder involvement and participation being most important. My research aims were not only to document the situation at hand, but to identify the needs of the community alongside room for potential preventative interventions. I hope you enjoy this documentary. Thank you for watching. The journey begins at Queen Elizabeth Central Hospital's dental department, which had become very crowded with patients arriving both from referral and walk-ins. Many have travelled hours, most presenting with pain and late-stage disease. Extractions are often the main form of treatment carried out. Without general anesthetic or sedation being treatment options, children especially can find these experiences overwhelming and distressing. I got to meet Ruben, a 5-year-old boy who presented with pain and was very anxious. Like many children, he was fearful of treatment. We got to look at his teeth, which had multiple caries, this highlighting the burden of untreated dental disease faced by so many young patients. I had the opportunity to speak to Ruben's mum about this. I'm here with Ruben's mum. How old is he?
5 years.
5 years.
Yeah.
And why is he here?
Tooth pain.
Tooth pain.
Yeah.
And how long does he have the tooth pain?
It's been for 2 weeks.
2 weeks.
Yeah.
And has he ever been to the dentist before?
No.
No. This is the first time?
Yes.
Yeah. And this pain, he can't sleep. Is it waking him up?
Yes, he can sleep.
And what have you been giving him?
I just give him Panadol.
At all.
Yeah.
Does he go to school yet?
Yes.
Yes.
Yeah.
Has he been able to go to school with the pain?
He can go to school, but the rate that he comes back
He comes back early from school?
from school, yeah.
So it's disturbing his
Because
school
of the pain. Yeah.
because of the pain?
Yeah.
Okay. And in terms of every day, does he brush his teeth?
Yes. He brush his teeth 2 times a day.
And what do you use to brush his teeth?
Toothpaste, like Colgate.
Colgate.
Yeah.
And a toothbrush.
Yes.
And where do you buy this? The supermarket?
We buy it for market.
Market.
Yeah.
Is it a good price? Like, is it okay? Can you afford it?
Sometimes we can afford it, but it is too expensive.
It's too expensive.
Yeah.
Okay. And do you know how to take care of his teeth?
Yes.
Yes,
Yeah.
you know. And do you brush your own teeth twice a day?
Yes, I can.
Yes.
Yeah.
Yes, you do. Okay. Do you know how much sugar a child should have?
I really don't know.
You don't know how much sugar a child should have. And do you monitor how much sugar he has? Like, do you check how much sugar he's having?
Yes.
Yes.
Yeah.
So, like biscuits and juice. Does he have biscuits and juice?
No.
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 Okay. Rubens came with pain, and they're going to take out the tooth, but he's scared. Isn't
Yes.
he? He's too scared. Are you waiting to try later?
Yes, you can.
Speaking with Ruben's mother revealed some insights into the reality of pediatric oral health. The lack of preventative and continuous care and treatment planning available, the lack of sugar awareness, the lack of affordability of oral hygiene equipment, and the widespread effect of dental disease burden, not only causing pain and discomfort for the child, but affecting their school attendance and their parents' work. To try later. With no capacity for pediatric services in the dental department, there are few options beyond restraint when treating children. This not only exacerbates dental anxiety, but leaves no space for prevention or continued care. As the needles and the dental chairs are all bought and standardized for adult care, this leaves multiple challenges. To effectively carry out a CEI-led research project, stakeholder identification and community advisory board formation is important to lead and guide research. I was fortunate enough to interview the stakeholders and gain a representative view on things. First interviewee was Dr. Wellington Chikuni, a dental surgeon based at the Queen Elizabeth Hospital, an assistant national oral health coordinator alongside part-time lecturer at the dental school. The aim of this interview was to understand the paediatric oral health capacity of Queen Elizabeth Hospital, as well as the challenges faced by day-to-day practitioners. In regards to Queen's, I'm going to ask you, what's the current capacity for paediatric dental care at Queen's? Are there any dedicated services, resources at all?
Not necessarily. I think what we have been trying to do is to isolate a room for the pediatric clients or patients. But well, when you look at like equipment, like well customized equipment for pediatric care or the materials and all that, so far I would say we don't have such. Only that we have a room which is not like 100% in use.
In regard to that room, I heard that it's something to do with Colgate, that they painted the walls in that room. Could you explain more about that story?
Oh, okay, all right. So we approached Colgate Palmolive with the idea like, okay, we want to have a separate pediatric room where we'll be handling our young patients, and they were like, okay, I think we're going to come and decorate the room. Then anyway, Colgate Palmolive have been so supportive when we talk about the dentistry in Malawi, so especially preventive and the pediatric dentistry. So this time they were like, okay, we're going to do that. So they came in and decorated the room and all that. The only part that we had to, we also to resource like a small chair, like a dental chair, that the thing that are more pediatric stuff, like giving the equipment, giving the sedation, so that we're able to handle the patients well. But it never so happened. But with the role of Colgate Palmolive, we didn't let appointment that they were going to furnish the room and all that. It was more for them to come and decorate the room, and wherever we need their support, they'll come in. But in terms of equipment, we are supposed to source equipment.
Okay, that's fine. And in terms of sourcing equipment pediatrically, is that a priority currently at Queen Elizabeth Hospital? Is there capacity to have it as a priority?
I wouldn't say yes, because the approach here is more of the general approach. We have not really got into more specialized, because dentistry is it's quite expensive. So with the resources locally the approach is more like, okay, what can meet the majority of people. We talk about, if we're purchasing needles, we bring the standard in it because we are going to use them in pediatric and even the others. So it's the general kind of approach. So it's the resource limitation, I'll put it that way.
Thank you. So in terms of, in your opinions, what's most urgently needed to support pediatric dental care for children? Is it more infrastructure, staff, or equipment? What would you say is most important?
I'll still go for both, because we really need a specialist in the area. Okay, the specialists that are on that understand better. Of course, we would say that even dental fellows are able to handle pediatric clients, but still something lacks in there. And then talk about the equipment. We need those equipment that are more customized to the pediatric care. When they walk in the room, they should feel like more welcomed. And we talk about even the pain handling, the pain management in pediatrics is different from another. So we need all those. Even talk about material. So I'll go for all the areas. Really, I'll put them at. We really need all those areas.
That's fine. Yeah. Okay. So in terms of community-driven approaches, like preventative care in schools or training teachers, do you think this could complement the health services at the hospital?
Yeah. That's the way to go, because I think preventive has to be a primary thing in our minds, because dentistry, like we talk about dental care, these are preventive, like they are preventable. If we are to give it much effort into it, we can minimize the number that are coming to our facility for teeth extraction, even restorations, let alone pediatric care. Like these people have just elapsed and they are so new. If they receive enough care, they might not even get caries. So if we are to really incorporate like the schools and all those people on the ground that are able to handle, like indirectly in contact with the community, I think we can have an impact and then reduce even the burden at the tertiary level.
Yeah, because I was going to say, when the children do come to Queen's, is it usually for extractions? Is it usually like a late stage presentation that you're getting?
Yes, that's it. Like most of the time when they come, they're in pain, then it's equals to extraction.
Yeah.
Because even for the child to complete that have a cavity, it's layer until it's starting hatching, and
Yes.
when they're coming to that level, I mean it's not going to the papyrus level, or even it got an abscess.
Yeah.
So yeah.
In terms of, so I've been to Queens and we'll see how busy Queens can get. In that appointment where the tooth extraction is happening, the consultation is happening, is there any chance to deliver preventative advice or oral hygiene advice, or is that just not achievable considering how many patients that you're seeing?
Yeah, actually, at Queens, that's what we all normally do every day. When the patient are they are passed through the reception, they are sitting on the waiting area. They are given a talk every morning. They are given a talk, a preventive talk, and even how they would manage the posterior whatever treatment. They would put like, okay, after extracting, if you have a restoration, do this like that, and then you give them a talk how to prevent more of occurring of that, how they should go back, how they should brush their teeth. We really do that each and every
That's
month.
great.
Yeah, sure. So, but the only challenge, like we're talking to people who are in pain.
Yeah.
So, like sometimes they just feel like someone just wasting my time. Or I
Yeah.
want to get treated and go home.
Yeah.
Sometimes they walk in a cubicle and then you just ask them like, okay, um, we told you how do you brush, when do you supposed to brush?
Yeah.
Like they're just looking at you because
They're very irritated.
like, well, why are you wasting my time?
Yes.
I just want to have my tooth removed.
Yes.
You see? So we see like we are tagging people who are already in pain.
Yeah.
So if we are to take it to the community where people are okay, I feel like the message will have more impact there than at the.
With the support of the Maldent Project, Malawi celebrated the graduation of its first cohort of homegrown dental students in 2025, and a new dental school is now under construction. To discuss what this means for the future of oral health in Malawi, I spoke with Dr. Chimimba. Good morning, Dr. Chimimba. So, in terms of the history of the dental school here, could you give us a brief overview of how the dental school was established?
Yes. When they established the medical college as part of the University of Malawi, there had always been a plan to start dentistry as the next course. But there were challenges at the time, and the challenges were to do with staffing, really. The infrastructure was not good, and also I think the political will wasn't there. So in 2017, a colleague from University of Glasgow, Professor Bagg, Jeremy Bagg, came over to inspect and have a look at what was available, because the University of Glasgow was requested by the University of Malawi College of Medicine to help establish a dental school. Our plan to train dentists locally, dentists who were, as we put it, globally competent but locally relevant. So I was part of the team that visited University of Glasgow, met the team there, and we established the Maldent Project at the time. And the main thing with the Maldent Project was to establish a BDS program at the university. But also apart from that, there was a request from the ministry. There was no oral health policy, a proper oral health policy. So we managed to develop that with the pillars related to governance and leadership, preventive, clinical work, infrastructure, research, and a lot of other things. So that we were very pleased about.
So in terms of these locally trained dentists, what impact do you see them having on the...
Or a major impact, you come from a country where there's a population of about 18 to 20 million people with 40 plus dentists. You inject in 10, you're already at 50, and these guys are enthusiastic. They want to move dentistry forward, and they seem like very keen and focused on doing it.
What, from your perspective, the role that prevention could play in establishing dentistry in Malawi?
That's the way to go. Prevention, because when you have a few dentists, they're limited to what they can do in a dental setting or dental surgery setting. So you are looking at prevention where you could involve a lot of other stakeholders, teachers, community leaders, and the parents to involve them in preventive work. And the good thing about prevention is that it's something that doesn't cost you that much money when you compare to orthodontics or restorative work. So that's what we're encouraging our students to do. I mean, that was the key part of our mantra: prevention, prevention, prevention.
Thank you. And in terms of what challenges do you see in promoting prevention, definitely considering the already existing burden dentally wise in Malawi?
Well, we just don't have the people, and then we need to train them. Already there are programs that are, especially with NGOs, mainly in the northern part of the country, but we're rolling those on where we're using volunteers, we're using the community to be involved in prevention. So it's a challenge, but I'm sure for me, it's the best way forward than being stuck in a clinic doing restorative work.
The Malawian population, when it comes to their oral health, how aware do you think they are, if you can say, about the importance of prevention?
There are very few studies done, so all I would say is anecdotal, and people are interested in their oral health, but things like toothbrushes, toothpaste are not freely available to the public. They're seen as a luxury, not as something that you should have as part of your natural way of life.
This is Chilomoni Health Centre, located just outside of Blantyre City. It's recently been renovated through the efforts of the Maldent Project and Amica Charity. Here I spoke with Wisdom, who's worked at the dental clinic for over a decade. Wisdom, so we're here at the Chilomoni Health Centre, and with your long-standing experience here, I would like to discuss some things with you. What usually brings the parents to finally bring the children for care?
Normally it's toothache. That's what, because people would be walking with bad teeth as long as they're not aching.
Yeah.
It's not a problem. So it's been toothache.
Pain.
But then that's when we'd see other issues that they are also, apart from trauma, where the child is just being traumatized, you literally see the parent rushing to
come
the
in.
clinic. Yeah.
And do you think that these parents understand how to take care of their children's teeth?
They themselves are struggling. Their teeth are as bad as you can imagine. I trust they don't understand, really.
And in terms of the oral hygiene practices at home, from what you've gauged over your past 10 years, would you say that in this area, because Chilomoni, I know that there's villages nearby and there's also more urban areas, are they practicing oral hygiene at home?
Both the urban and the villages, the results are the same. They don't. I think they think they do, but they don't.
And so can you describe that further?
Yeah, because you would see people coming and you look at the general oral hygiene, it's fine, but then they have carers. Like, okay, this was not supposed to be the case in the first place. How do you blush? And you discover their blushing technique is well superimposed.
Yeah.
They're doing the wrong things. They have the right things, but they're doing the wrong things with this, and that's why they have these issues. So we've been trying to correct, but the problem is the patients you see, they are exiting. You get it? You give them the information, but the others you have not seen yet, they don't have the information.
Yes.
We've tried to raise the awareness, but still more with limited resources, we couldn't do it at large scale.
Yes.
So we are raising awareness just basically at the clinic level.
Yes.
That's it.
Yeah. So, in terms of the health system as a whole in Malawi, how do you think they could better support prevention at a community or school level?
I think we have done this before. I think one of the things is there is integration. Even now, the Malawi Vision 2063 is one vision, one budget, it's putting everything into one vehicle. That if we're doing this, all of us have to do it. So when we're rolling out the survey, we had a survey, an oral health survey. We were working with teachers who are trained to do the health promotion with us. So we couldn't go there as health professionals to promote health because we're already teachers trained. So I think there are already people who are set aside to to easily switch and
yeah.
push these things forward. So I think there is that integration in different sectors. Even if we
Okay.
go to the education department, they are there already.
They're there already.
Yeah,
Oh,
yeah.
that's amazing. So, if you could design a community or school-based oral health program, what would it look like?
Okay, I think we have done that before. It's something that needs health professionals in there, teachers, parents. You see, it's just something that it's going to be a compendium of one to stand for parents,
Yeah.
one to stand for teachers, and the stream of health professionals that will come in.
Mm.
So whatever we want to do, we use these people, discuss it, agree, and then launch it.
Launch it.
Yeah.
In terms of a model for prevention for pediatric oral health in Malawi, what do you think is the most sustainable model?
Well, I think one of it has to be, or if it has to be one thing, it has to be, I think, prevention at grassroots. I think that is one of the things that we really don't have. And if we would sustain that at grassroots, train them how to brush, how to take care of their teeth as young as they are, I think that would prevent a number of things that people are suffering from at an advanced age.
Advanced
Yeah.
age.
So it's prevention at
The very lowest level.
lowest levels.
Yeah. Community engagement and involvement research is driven by the community itself, and spending time with local children was key to understanding pediatric oral health in Malawi. Thanks to the Beehive organization, I attended feeding programs at St. James Church in Chilomoni on several occasions. Here, I delivered oral hygiene demonstrations and answered questions from both children and their guardians. These visits allowed me to build bonds with the community while also conducting interviews with children about their experiences and understandings of oral health. Hello,
Hello,
my name is Anna. And what's your name?
my name is Tupar Frank.
Tukwa Frank.
Tumpari.
Tumpari Frank.
Yeah.
Wow, it's a beautiful name. Thank you. I'm going to be asking you some questions about your teeth.
It's only in the morning.
Only in the morning. Right, perfect. And what do you use to clean your teeth?
Essentially.
And sticks,
And who taught him to use the sticks?
madam.
Mother. Yeah.
That's the class teacher.
Oh, okay. Class teacher. Okay. Have you been to the tooth doctor before? No. And have you ever had pain in your teeth? And where did you go anywhere?
Nangu kara kinabono rabira masigoje ba namzugurna azisi.
Right, so he didn't go anywhere, but after some time, there was liquid in his spine.
Okay.
Like there was no pain anymore.
There was no pain after some days.
Yeah, but he didn't go anywhere.
Okay. Is that tooth? Does he still have the tooth?
Like it's not a little bit away.
Yes. Okay. Do you like your teeth? Yes. Why?
Fayodino amata kujira zilizorino manja sangati.
Actually, the teeth are able to do something that the hands cannot do.
The teeth can do something that the hands cannot do. You know why we brush our teeth? Why we clean our teeth?
Which way we was to get them?
Fayodino mafunori manoto akalorereze.
It's as a way of protecting the teeth from disease.
Disease. Okay. And do you know what's bad for your teeth? No. So, sugar is not very good for your teeth. Does he like biscuits and
Do
sweets
you
and
like
stuff?
sweet sugar? Yeah. He doesn't like.
Are you sure?
Yes.
Are you sure?
Yes.
Oh wow, okay. You need to teach me. He needs to teach me. Okay, Vanessa, how old are you?
I am 11 years old.
You're 11 years old.
Yes.
Okay, Vanessa. I'm going to ask you some questions about your teeth.
Yes.
Okay. Do you clean your teeth?
Yes.
Brilliant. When do you clean your teeth?
I clean my teeth in the morning,
Yeah.
afternoon, and in the evening.
And in the evening.
Yes.
What do you use to clean your teeth?
I use the toothbrush.
Vanessa, could you speak a bit louder for
I
me?
use my toothbrush.
You use your toothbrush.
Yes.
Okay. Do you use anything else?
Yes, Colgate.
Colgate. Do you always use toothbrush and Colgate, or do you sometimes use something else?
Yes, I use toothbrush and Colgate every day.
Every time.
Yes.
Okay. Have you ever been to the tooth doctor?
No.
No. Have you had any pain in your teeth in the last 6 months? No. Do you like your teeth?
Yes.
Yes. Why do you like your teeth?
Because it helped me to eat the food.
To eat the food. Yes,
Yes.
me too. I like my teeth for that as well. Do you know why we clean our teeth?
Yes. We clean our teeth to avoid diseases.
To avoid diseases.
Yes.
Wow, you must be really smart for an 11-year-old. Okay. And do you know what's bad for your teeth?
Yes. Sugar, biscuit, and sweets.
Sugar biscuits and sweets. Do you like sugar biscuits and sweets?
No.
No?
Yes.
Are you sure?
Yes.
I like sugar biscuits and sweets. You don't
I
like?
just like sweets.
You like sweets?
Yes.
And how often do you have sweets?
Many times.
Many times.
Yes.
Every day?
No.
No.
Maybe. Okay, every day.
Every day.
Yes.
Okay, that's okay. Me too. Don't tell anybody. Okay, thank you so much for
Pros.
But sometimes they use ash from the wood.
ash from the woods.
Yeah.
Yeah. Okay. Have you ever been to the tooth doctor?
No.
No. Have you ever had pain in your teeth?
Sometimes when I wash my teeth, I feel pain.
Sometimes when you brush it, you feel pain?
Yes.
Okay. Do you get any bleeding sometimes?
Sometimes.
Sometimes. Okay. Do you know why this may be?
I know because when I wash my teeth, I feel pain.
Yeah. Do you know why? Maybe like what you're eating or?
I know.
No. Okay. And do you like your teeth?
Yes.
Yes. Okay. Do you know why we clean our teeth?
Yes.
Could you explain to me a little bit?
To have clean teeth, to be healthy.
To be healthy. Yeah. And do you know what's bad for your teeth?
Yes, but again.
Do you know what's bad for your teeth?
Yes.
And what would that be?
Like biscuits, sweets, and sugar.
Sugar. So, do you like sweet things?
Sometimes I like.
Yes, so do I. I like sweet things too much. It's not good for my teeth. Okay, and if you had pain, so this pain you have in your teeth, do you know where you would go? Like, where would you go if you had pain in your mouth? Like,
Yes.
would you go to the doctor? Would you go to the health center? Where would you go? Do you know?
Doctor.
Yeah. And where's your local? Where would that be?
Children Health Center.
Chilomeni Health Center. Okay. Have you ever had any of your teeth taken out before?
Yes.
No.
No.
No. Okay. That's good.
No. That's a big.
He wants to remove the tooth on his own.
So you took out your tooth on your own?
Yes.
Why?
But it's not going to be here.
What?
Not going to be there.
Okay. Yeah, it was a bit of shaking, so that
It was wobbling. Yeah, so he just took it out on his own. Was it painful?
Yes.
A beautiful part of community engagement and involvement is seeing the community itself take the initiative in research. Here I was joined by Matoni Basato, a final year dental student who helped with translation and oral hygiene demonstrations. Later, through the support of one of the new graduates, Emmanuel Kapaninga, and Benjamin Williams, a final year dental student, we visited Chilomoni Primary School. Together we carried out a pilot study, delivered oral hygiene demonstrations, and held a Q&A session with the kids. How many times a day? Twice. And when did you do it? When did you do it? And here's the tricky question. How long do we brush our teeth for? Anyone know? 2 minutes. 2 minutes. Well done. So we brush teeth for 2 minutes, and we make sure we brush everywhere. Okay? Yes. Wow, Michelle. Wow, well done. You need high five. Well done. So you said at home, if you don't have toothpaste, what should you use? Salt. This is an important question. What is the value of oral hygiene knowledge if it cannot be applied because of resource constraints? I wasn't sure how to answer this, but I encourage the idea of brushing, even with chewing sticks. Toothbrush, you can use, anyone here use anything else to brush your teeth before? Anything else you don't use? Chewing stick? Yes. So you can use that as well to brush your teeth the same way, just anything you can use to just clean your teeth, okay? Mothers hold the key to their children's oral health, guiding what they eat, how they brush, and when they seek care. Wanting to hear their perspective, I joined a discussion with local mothers led by final year dental student Matoni Baseto. She steered the session with warmth and empathy, allowing their stories and challenges to be shared openly.
So she's saying that motivated. So there's so many things that we will recommend. Like there's a medicine for a herbal medicine that they say that you should put on the teeth, and then the teeth starts to deteriorate a little. That's breaking down to something something like that, and then it goes away like that. Is that necessary? No.
These questions, among many others, reveal the myths and misconceptions that mothers held about oral health. A discussion meant to be about children uncovered that many of the mothers themselves had a limited understanding of their own oral health. From beliefs in worm theory, uncertainty about the true causes of dental decay, a lack of trust in the dental healthcare systems available, it highlighted that oral health education is needed at every level of the community, not only for children, but also for caregivers. We can see that the gap in dental knowledge required time and effort on multiple fronts. A more proactive, preventative approach is needed to directly tackle the burden of disease in children. In 2023, the World Health Organization listed silver diamond fluoride and fluoride varnish as essential medicines, a landmark decision for low-income countries like Malawi. Both are high concentrations of fluoride that can be applied by non-dental staff to arrest existing caries and prevent new decay. Programs delivering these interventions have already begun in other low-income settings, and Malawi could greatly benefit from an approach like this. To explore the perspectives of the community and professionals, I spoke with Dr. James Machenga, Dr. Chimimba, and Dr. Chikuni. In regards to silver diamond fluoride and fluoride varnish application as a use of a more proactive preventative approach, what are your opinions on this so far?
It will be something worth considering because to begin with, people are used to white teeth. White is associated with good teeth, and therefore, if somebody has dark ones or black ones, it may be a problem to some. But if it is for the posterity, then there's no issues because as long as they're not painful, then that will be fine. So again, it will be a question of educating the public and to say to them, look, the fact that it is black does not mean it is bad, right? It is better to have a black tooth that is controlled than a white tooth with caries. Yeah. So again, it will be a question of education, patient education, that is, and also the practitioners, because most of our the dentists and some of our people may not be aware of this. So once that phase is breached or is crossed, then I think that should be fine. Yeah.
And so in regards to, I know you see some special care patients that are also young, they would also fall into the line of being pediatric.
Yeah.
Could you see SDF as something that would really help them?
Yes, for sure. That's for sure.
the special needs patients, the Down syndrome, that kind of patients, I think there is room for SDF, because it can be applied before the carriers have gone far, and therefore going for prevention. It will be much, much cheaper. And it also means that if we can help the caregivers to say, you are going to apply it, and therefore they'll get more cooperation from the caregiver than somebody else coming in with a white collar.
We have looked about SDF and fluoride varnish. I was going to ask you, what are your thoughts on the potential of this improving child oral health in Malawi?
Oh no, quite really. I feel like it's a welcome thing. One, they are not too aggressive. They can be done almost everywhere. You don't need a lot of tools to do these things. And like not much of possible, even if someone who could be just trained, not someone like who's not a dental professional, they can be able to apply that. So I feel like we might really, it's a welcome thing. It might have an impact and minimize conditions that may progress to serious stuff. So I feel like if we are really to incorporate that into our primary health care, that would be quite helpful.
So thank you. My question is, in terms of resourcing this, so you work with the hospital, if this initiative was expressed in a way in which it was clear that, okay, the downstream effect, it would reduce the burden on the hospital, do you think it's something that you could get governmental or even hospital support in delivering?
That's where we have a little bit of challenge, because we have been trying so hard that the dental services, they should be incorporated in we call them the non-communicable disease package. But so far, we have not really been considered much. When they talk about the budget, these are kind of looked down a little. I have to admit that they're kind of like, they are more, the issues that are coming in, they are more on the curative level, which is not having much of the impact. And then if you have to look at the cost of like the CJF, that's kind of expensive. So that's where I think we need now to work with the government system to say, okay, incorporate these things, and then if we are the leader to consider take this on board, I think that would be a very best idea.
Yeah. If this program was to be rolled out, let's say in Blantyre, what do you think could be done to make this a success?
Well, you'd have to involve a number of stakeholders. The Minister of Health has to be involved. The Minister of Education has to be involved. The Ministry of Local Government and the NGOs. There are quite a few NGOs who are involved in oral health prevention. So I would say at the beginning, start at the strategic level, get the approvals done, and then at a local level, in terms of application, the teachers become key, and also your communities become key. And there are a lot of people who would be interested to help, even religious leaders, traditional leaders. They would be like your change personnel.
Yeah.
The concept of delivering fluoride varnish at schools has been done many times before, and through conversations I learned that the project was done in Blantyre and ran by Wisdom, the dental therapist. We had a great opportunity to discuss this project further.
A fluoride varnish program that was done in affiliation with Colgate. Could you explain to me what that was and how that worked?
Well, it was a nice initiative because we thought, we always prioritize prevention. It's better than cure. So we thought one of the ways to arrest and prevent dental caries was to give fluoride varnish. And we were supplied some by Colgate. We did it, but we could not sustain it. It was a good experience because I felt like we are giving the kids the help they need. But we couldn't sustain it. So it was just like one time off, and once the supply is finished, we couldn't even redo it. Yeah.
In terms of rolling that out, was that done at local schools?
Yeah, we did it at local schools. We raised the awareness, we went to schools, talked to the parents, and they gave an okay. So some of them were not okay. There was a consent form. If they don't feel like it was okay, but the majority, maybe 90%
of them were okay with it.
Yeah.
So, okay, based on your experience with that project, do you think SDF and fluoride varnish could be used like in Malawi, definitely in the districts?
Definitely, because I think one of the most important part of Colgate at large is the fluoride. I think if we would do that, I think I trust it has a long-term impact. So I think it will do us a good job. I would recommend that for the kids here.
A quick question just back to the Colgate and when you're rolling out the fluoride varnish. In rolling out the fluoride varnish, did you see a change in the attitudes of the children towards their oral health? Like, were they, did that make them more aware of their teeth? Like, what was the impact, would you say, on the children?
We had that interaction with the kids. We saw them asking questions of what they don't understand. We saw them yearning to learn even more. So I felt like that brought in that awareness. It raised the awareness to another level of which it helped at large because they learned even more than what we could normally share. It gave us a broader audience, to air out our views and discuss with the kids. Yeah.
Amazing. In terms of improving community acceptance of these interventions, could you think of anything that might help improve acceptance of?
Yeah. I think one of it is raising awareness. I think that's one of the things we miss. We feel like, and when raising awareness, we have to use a language they would understand. I think one of the barriers we had when we were rolling out with the Colgate was the fluoride varnish with the Colgate was that we brought in language that was not common in the villages, so they couldn't really get what we're trying to bring. But I think with proper awareness, I think the results can be even tremendous. We can get even more than what we bargained for.
This journey has brought together a wealth of experiences, voices, and insights. From these, I'd like to share some closing messages. If you could deliver one message about oral health to the wider community of Malawi, what would that be?
Watch your diet, brush your teeth. Simple.
Wash your diet, brush your teeth. Simple. I think the whole world could do with that message. Thank you so much, Dr. Chirimba.
I'm happy that this is the beginning and this can form the foundation. We're only forming the foundation in which we can grow. And I see dentistry growing and people getting their oral health issues managed and treated quite early on. And because we know that oral health is the gateway to general health, so it couldn't have come at a better time than at this particular stage. So it's very bright, actually. There is a very big light at the end of the tunnel, if I may say.
Thank you so much. What comes next is clear. More conversations, more outreach. Change cannot be driven without them. My hope is that this documentary inspires new ideas and a deeper understanding of the needs of children's oral health in Malawi. Thank you for watching, and a special thanks to all those who supported this project.